Hey everybody, welcome. Today we are talking about, can you treat a yeast infection while you're on antibiotics? Let's dive into this topic as yeast infections are so common. And so you're going to learn by the end of this video how antibiotics work, how the vaginal microbiome works. You'll have a full picture on the symptoms and what you may experience with a yeast infection. And we'll talk about treatment options that you can take while you're on antibiotics. All right, so let's talk about this topic today. It is near and dear to me because this is something that we consider to be like the bread and butter of medicine, or at least of OBGYN medicine, because it is so common. Up to 75% of females will experience at least one yeast infection during her lifetime. That's a lot. That means on average, most people will have one. And the sad part about it is that while you may have one yeast infection, there are others who have recurrent yeast infections, meaning that you may have 2 or 3 or 4 or more per year. And so we don't want that. And so if there's something that we can do to help, we will do that right here in this community. So thank you for listening in. We're here to help make things a little bit better. Let's talk about a yeast infection some more. Yeast infections are caused by a fungus. And so we call it a yeast infection for short, but truly it is a candida or a fungal infection that may happen. And these infections, like fungal infections, can be in a variety of places in our bodies. Like we can have thrush in our mouth that is caused by a yeast. And so we don't call it a yeast infection necessarily, but it is the same mechanism and the same process of having a fungal problem in our bodies. Yeast infections specifically are targeting the vaginal area. And so here is what I think the interesting point. In our vaginas, we have yeast living there on a normal basis, and it's okay, and it's not an infection. When we think of the microbiome, we're thinking about all the pathogens, all the bacteria, all of the fungus that normally lives there, and it is okay. It is okay as long as all of these pathogens remain in a certain amount. So for instance, when we think of yeast, when we think of the fungus by name, Candida, if you're supposed to have 100 Candida living in the vaginal space, if we have 101, we have an infection. If we have 200, we have an infection. If we have 1,000, we have a whopping infection. Get my point? And so normal is in a certain amount. Anything that is an overgrowth or an excessive amount then leads to an infection. And so let's turn the table a little and let's talk about antibiotics. There are so many different types of antibiotics on the market. There are antibiotics specifically for ear infections, for eye infections, for a GI bug. We have antibiotics that are for the pelvis versus the lungs, like pneumonia. And all of these antibiotics function and work differently in our systems. But what we do know is that antibiotics in general will influence the microbiome of the vagina. And the reason is, while antibiotics may target certain areas of our bodies, like for instance, an ear infection, we know that certain antibiotics will kill a bacteria in the ear. What we also know is that as specific as that antibiotics might be to that infection, it also influences all the other areas of our bodies that bacteria lives in, which is most of them. And so while it targets the ear, in the case of an ear infection, it also influences the gut, the vagina, and or skin, and other places where bacteria lives. In a location where the bacteria living there is in a normal amount, because this antibiotic is in our system and impacting everything, it may now cause that area to have an infection, specifically in the vagina, because too much antibiotics or antibiotics in general will lower the good bacteria that's there, causing the balance between good and bad bacteria to be off, leading to an infection. And so it is like a domino effect. And so because of that, it is very common that regardless of the kind of antibiotics that you are using or you were given or prescribed, regardless of the initial problem that we were trying to solve by giving you antibiotics, if you are a female, it is very highly likely that you will get a yeast infection during your treatment or after your treatment. And so if you're thinking, well, I'm in this scenario, I had an infection, I was given an antibiotic, and now I'm having symptoms of a yeast infection. What do I do? The first thing is to understand and know the symptoms of a yeast infection. The first is that you may have itching. I'm going to say that that's probably the most common symptom that I've seen in my patients. And so itching could be on the vulva, on the outside of the vagina. It could be that you feel like you can just rip your vulva out because the itching is so intense. It could also mean that you may have a discharge that is thicker, clumpy, and wider than your normal vaginal discharge. And so oftentimes we compare this to cottage cheese but I can tell you that sometimes you may have this infection and not have a cottage cheese like discharge. And so the itching, a change in your discharge is a good start to know that you may have an infection. And if that's the case, you have plenty of options as far as what to do. If you're here, you're wondering specifically, can I take treatment while I am on antibiotics? And so the answer is yes. You can absolutely start treatment while you're getting antibiotics, but I have a few things I'd like to discuss with you here. The first is that if the start of the infection is the taking of antibiotics, if you're still taking antibiotics, the likelihood of you still having an infection is going to be high even if you started treatment for the yeast infection, okay? And that's because the culprit is still in your system. The infection was caused by antibiotics. As long as that antibiotics is still in your body, you're still taking it, which I want you to, because you're taking it because you have a greater infection that you're trying to treat. So don't skip that. But what I want you to do is once you've completed your antibiotics, I want you to continue your yeast infection treatment. So I'm going to break that down for you just a bit, just to make sure that we're clear here. You have a primary infection. You were given antibiotics. Your antibiotics will last a course of time. So it could be 5 days, 7 days, 14 days. During that time frame, you have a yeast infection. You start taking yeast infection treatment at the same time while continuing your antibiotics course. You can take both together because that will help your symptoms so that you can feel like you can sit and walk and move and be while you're on antibiotics. However, continue your yeast infection treatment beyond completing your antibiotics course, because as long as antibiotics are in your system, you will be prone to getting the symptoms of a yeast infection. And so, in general, most antibiotics will be out your system about 24 hours after completing that course. And so whether you're taking pills or you're getting an IV treatment of antibiotics, regardless of what it is, you want to wait 24 hours after your last treatment before you are truly going to see a big change and get the effects of the yeast infection treatment that you're taking. So 24 hours after, you may use one of the 2 different treatments that are given for yeast infections, either suppositories that you use vaginally. And if you would like to know more about that, I have plenty of videos that talk about the treatment for yeast infections, and I dive into that. So if you'd like to do that, please check out my channel and some of my other videos here. A suppository goes vaginally, or you may take a pill, both of which can well care or cure your yeast infection. But for your symptoms to be completely gone and for your infection to be completely cleared, you want to wait at least 24 hours after treatment is complete with the antibiotics before taking or completing or finalizing your yeast infection treatment. I hope this makes sense. And listen, if you have questions about this and you're just like, well, I just wanted some clarity, or you just want to make sure, please drop that comment below. And if you would like to help your body, if you would like to know if your lifestyle is conducive to helping your body be able to handle antibiotics without having a yeast infection, or if you're just looking for ways to hormonally become more balanced, I have a special gift for you today. Below at this link, I am offering you a free copy of my ebook, Hormones Don't Lie. And I'm offering this because you're here and you're listening and you want to help your body. I can tell because you're here and I want to help you on this journey. And so if you click the link below this video, I'll send you a free copy of my ebook so that you can read and learn and become more empowered at home in your own space on your own time. Thank you so much for being here. Let me know if you have any concerns and I'll be happy to respond to you. You take care and I hope to see you in a future video. Take care.